infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to the show. Now, Minnesota state health officials reported recently on a number of acute flaccid myelitis cases, or AFM, in children that occurred in the past month. So what is acute flaccid myelitis, and what's the situation in Minnesota? Well, joining me now to discuss this important topic is Michael Osterholm, PhD. Dr. Osterholm is the director of the Center for Infectious Disease Research and Policy, or CIDRAP, at the University of Minnesota. Dr. Osterholm, welcome back to the show, sir.
Thank you very much.
You bet. Now, as I said in the intro, the Minnesota Department of Health is investigating a number of AFM cases across the state. Dr. Osterholm, what is the situation today in Minnesota? I mean, what can you tell us?
Well, currently there have been 6 cases identified, not any of them related directly to each other, and they've occurred since mid-September. Most of the children are recovering, although they still have some residual weakness or paralysis, and it's really part of a much larger national situation that's been occurring now since 2014.
Right, and the current cases right now, they're sort of spread out throughout the state too, right?
Right. These cases actually, well, they come primarily from 2 general areas, but there is no obvious connection between them. And if one assumes that this is an infectious agent that's causing this, and of course we have data from previous years' activities where at least one enterovirus has been implicated, but it has not been consistently implicated. And in this situation here, tests are still ongoing to determine if any of these individuals were infected with this particular virus, enterovirus 68, but at this time they're not completed yet.
Gotcha. All right. Well, this is a pretty serious condition, and it's, of course, causing some concern. Dr. Osterholm, what is acute flaccid myelitis and its symptoms?
Well, you know, if I could paint one picture that I think people would understand what this means, at least those who are, you might say, baby boomers or in that generation, and it's polio. This is something that our country successfully was able to eradicate out of the country by the early 1960s with the use of polio vaccine. Only rarely did cases occur after that, which were imported. Globally, the same thing has been true. As you know, we're now down to just a very limited area of the world where we see ongoing natural poliovirus transmission. If you try to understand that and what it means, acute, sudden onset, flaccid, really are talking about muscles that are not firm or not able to respond as normal muscular activity should. And then myelitis is an inflammation really of the spinal cord and the base area of the brain. And any number of different things can cause this, including viruses such as poliovirus. We also know that there are some environmental toxins and a genetic disorder that can also cause this. What makes us quite convinced that this is actually an infectious process is that these cases are not located only in one area where, if, for example, if there was a toxin or even a common genetic component. And if you look at the seasonality, it's very, very striking to see that the vast majority of the cases that have occurred since 2014 have occurred in the months of basically August, September, and then coming back down in October. Mm-hmm. And this has been true for 2014, and particularly in 2016 and now even in 2018. And what this really suggests to us is that this is acting like an enterovirus. This is the time of the year you'd expect to see activity. If you can go back to poliovirus outbreaks, oftentimes they occurred in the late summer and early fall. So this has all the makings of being a enterovirus-like agent or agents, and that's one of the things that's being entertained right now. Could this, in fact, be several different viruses like enterovirus 68 that we just haven't picked up yet that are also involved with the cause here?
Right. And you mentioned there's several different possible etiologies, viruses, toxins, genetic disorders. However, if it is enterovirus, there's really no treatment for it, is there?
Well, in fact, yeah, and just to go back to what I mentioned earlier about the epidemiology, I would really not believe that the toxins or the genetic disorders are playing a very important role here, if any at all. Because of the seasonality, this just smacks of an infectious disease issue. Where basically we see the same big increase in cases in the years where we see cases of any number, which really just supports the idea that there's an infectious etiology and likely an enterovirus type agent or agents that are causing this. So I think that's the case. In terms of treatment, there is no actual specific treatment for the enterovirus infection, but we do know from work that's been done with acute flaccid myelitis, particularly polio, that actually very aggressive and supportive physical therapy can help an individual respond to this. And there's a number of theories why, in terms of motor neuron development that is being forced around the areas where there was damage inflicted by the virus, etc. So that in that case, you clearly want to get your child into the medical system quickly if, in fact, they have this, because there is that type of support. The other thing I would say is that people ask often, well, how do I even know if my child has this? And again, the classic symptoms of acute flaccid myelitis are kind of a neck weakness or stiffness, drooping eyelids or a facial droop, difficulty swallowing or slurred speech, or just an inability to move a limb or have it function as you would necessarily want it. If any of those symptoms present in a child, you should immediately seek medical care.
Sure. And you mentioned earlier in the interview that it's not only Minnesota, but some other states are seeing some spikes of AFM. Where else are we seeing this?
Well, again, to put it into perspective, this really first showed up in 2014 when there were 120 cases in 34 different states. And then really almost an absence in 2015. 2016, we saw a substantial increase with 149 cases in 39 states. And then again, kind of a quiet year last year in 2017. And now this year in 2018, it's not widespread like it was in 2016 or 14. There have been 38 cases to date in 16 states. So from the total from 2014 to 18 is 362 cases, knowing that number is obviously going to increase. Sure. I think that's also important because, like polio, where there were often dramatic responses at the community level, where schools were shut down and state fairs were closed, etc., over polio. I just want to remind the public that as terrible as this condition might be, particularly if it's your loved one, there have been a total of 362 cases over this time period, which amounts to a risk of less than 1 in a million. And so, there are other conditions out there that should worry us much more in terms of serious outcomes for your children. Influenza is a good example. Last year, 80 children died from influenza. So to date, we haven't had any deaths here in these kids with this. So I think that that's really an important point, but nonetheless, it's concerning. And if we, in fact, can identify a specific etiologic agent or agents, surely there's always that potential for a vaccine if, in fact, the risk is substantial enough that we think that there's a reasonable investment return for a pharmaceutical company for taking a vaccine like this on.
Yeah. So what public health actions, if any, can be taken for something like this?
Well, right now it's really very simple and yet complicated. And that simple is just wash your hands, wash your hands, wash your hands. It's complicated because it's hard to get people to do that. Sure. Enterovirus transmission is typically fecal-oral. Meaning that from poor hygiene, not washing hands is important. One thing that has us a bit confused relative to an enterovirus-like picture is more often than not, the infection is more widespread in the younger age population, but they often are either asymptomatic or only mildly ill. And where you see more severe illness, actually, even though there's less transmission, is in the older population, and this has to do with the virus and the immune response age of the individual. And so, for example, during the old polio days, while kids were surely ill with polio, for the number that were ill, there were many others who were infected that didn't show really any serious signs or symptoms, whereas the many fewer adults were infected, but you often saw more people with serious disease. We have had a relative absence of adults with this. It's been primarily kids. And so, again, that doesn't quite make sense either if this fits in that enterovirus family, but that surely could be the case. So we're still looking at that very carefully as to what does this mean? What is happening here? And it's a lot more questions today than we have answers.
Well, that kind of leads into my last question. You brought up 2014 several times, and not only here, but if my memory serves me correctly, I think Canada had quite a few cases also. Mm-hmm. What did we learn from this situation in 2014?
Well, I think, first of all, we learned that this wasn't a single agent that appeared to be causing this, or at least we couldn't confirm that. There were several clusters where enterovirus 68 was apparent, and meaning that it was found and it sequentially was there at the time when the individual was sick. But we had a number of other cases where it wasn't found. And there was real efforts made to do that, so it wasn't just the fact that there was an absence of effort to find it. It really wasn't there. Now, were there other agents there that we missed somehow? Again, given the seasonality, I'm just convinced that this is an infectious disease issue. It may be a series of different agents. You know, when poliovirus, in a sense, fell out of the niche picture, meaning that they were no longer there, could other agents come along that do what polio did? Sure makes sense, but we still don't have the data to tell us what those are. So we need to continue the exhaustive and timely studies of cases, and the CDC and state and local health departments are doing just that, and I think they're doing a really good job of it, but we need more information to really give us a sense of what is causing this, and is it multiple issues, and then, you know, what can we do about that?
Excellent. Well, I want to thank you for this update and this information, Dr. Mike Osterholm, and your time and your expertise, sir. I appreciate it.
Thank you. Thanks very much.
Bet.